Name is Tiffany Johnson Lewis, and this is the Medicare Medicaid brochure for myself and Catherine Dahl. A little bit about Medicare. It is a federally funded government program that provides health care coverage. It is usually for people over the age of 65 or younger people with disabilities and people with end stage renal disease. Medicare has two parts. It has a part A and B for your medical coverage. You are eligible for a premium free part A if you're age 65 or older, or you or your spouse worked and paid Medicare taxes for the last 10 years. You can get Part A at age 65 without having to pay a premium if you do some things. One is if you're receiving retirement benefits from Social Security or the Railroad Retirement Board, or you're eligible to receive Social Security or railroad benefits but you have not yet filed for them. Or lastly, you or your spouse has had Medicare covered government employment. Medicare benefits and costs parts A, B, C, and D are as follows. Part A is when you apply for Medicare, you will automatically be enrolled in Part A. It covers hospital stays, hospice care, and some skilled nursing care that you may need after being hospitalized for, like a stroke or other episodes that require rehabilitation in like a rehab unit or a nursing home. Medicare charges a deductible each time you're admitted into the hospital. For 2019, it was $1,364, but it changes annually. Part B, this part of Medicare covers doctor's visits, lab tests, diagnostic screenings, medical equipment, ambulance transportation, and other outpatient services. The federal government sets the Part B monthly premium about which is about $135.50 for this year, but it could be higher based on your income. You could also be subject to an annual deductible. Currently, it's $185, and then once that is met, you'll only have to pay 80%. 20% of the bills, and Medicare will pick up 80. So that's where you get the 80/20 plan from. Part C, this plan will provide all of your Part A hospital insurance and Part B medical insurance coverage. Medicare Advantage Plus may offer coverage such as vision, hearing, dental, and/or health and wellness programs. Part D prescription drugs generally has some premiums and other out-of-pocket costs, either flat copays for each medication or a percentage of the prescription cost. The average nationwide monthly premium for 2019 was $33.19. And although plans cost vary depending on the plan you choose and where you live, they do have a deductible. So this is determined by the state that you live in. How you can apply, you can go to www.socialsecurity.gov or by calling a 1-800 number or in person at your local Social Security office. For Medicaid is a healthcare coverage program that is funded by the state. That's the difference in Medicaid and Medicare. One's federal, one's state. It has broad federal guidelines. However, although the federal government pays a portion of the cost, Medicaid is administered and operated by the states, and each state's program is a little different depending on the needs and the goals of that state. Who qualifies for Medicaid? You may qualify for free or low cost care through Medicaid based on your income and family size. In all states, Medicaid provides health coverage for some low income people, families and children, pregnant women, the elderly, and people with disabilities. Some states, the program covers all low income adults below a certain income level. There is another form of Medicaid called the Children's Health Insurance Program, and it provides health coverage to eligible children through both Medicaid and separate CHIP programs. And CHIP is administered by each state according to federal requirements. This program is funded jointly by the state and the federal government. Medicaid has mandatory benefits and optional benefits, and as I talk about them, CHIP has some of the optional benefits that are mandatory. So I'll explain. So for Medicaid only, you get your inpatient, outpatient services are mandatory. Your home health, physician, nursing facility service, family planning and midwife services, rural health clinic services, also federally qualified health centers fall under that. Transportation to medical care, lab and x ray services, tobacco cessation counseling for pregnant women. Optional benefits under traditional Medicaid is prescription, dental, optometry, podiatry, speech, and case management. However, under CHIP benefits for children, dental and optometry would be covered. What is the cost for Medicaid? Well, for most healthcare services, you won't pay anything or you'll just have a small copayment at the time of your visit. Most often, you show your Medicaid coverage card and the state pays the full cost of your care to your doctor directly. Some states under a federal waiver charge a monthly premium between $20 to $75 for certain eligibility categories, and you can contact your state Medicaid office to apply, or you can fill out an application through the health insurance marketplace. And I put this picture here to shows how in 2019 there has been a increase in spending, but not necessarily an increase in enrollment in Medicaid. You also have our references listed, as well as our names. I hope you enjoy the presentation and we look forward to hearing from your feedback. Thank you.